I would like to thank the convener of this meeting, Dr. Abiola, most especially, and the rest of the team for inviting me to give a short presentation about the role of fertility agencies in ART. Disclosures: I'm the owner of Medbarn Agency, and I am the second vice president of AFRH, and also the chairman of the Fertility Support Professionals Association. My outline is as follows, and I'm going to talk about what the meaning of fertility agency is. Really, in ART, I've been in the clinical space for about 20 years now, and I discovered that when you're in the clinical setting, your focus is getting the results for the patient. You don't have the extra time and energy to babysit patients, and I use the word babysit because that's what they need. When they're going through emotional stress, they really need to be babysitted. And this is where the role of the agency comes in, where they offer emotional support, counseling, advocacy in some instances, because some patients don't have the wherewithal to actually carry out the treatment of ART. And the one that stands out like a sore thumb is a third-party reproduction, as stated by Dr. Ajayi earlier. There's a lot involved in third-party reproduction, and the fertility agency is poised to take on this arduous task of taking care of this aspect of ART. What constitutes a fertility agency? You have to be registered to do what you said you're doing. You have to be able to say, yes, I registered my business to offer fertility support, and that's what I'm doing. You have to be affiliated with the Fertility Association so that you can carry out your processes according to the regulations and guidelines. I am happy to announce today that we have registered an association for the Fertility Support Professional Association in March to get all the agencies involved in ART together to be able to set the pace on how to carry out their services. The main mission is to support patients struggling with the fertility-related challenges and the healthcare providers who work with them to aid the realization of their dreams through empowerment, knowledge, most importantly, professional support and advocacy. The vision is to create a world where patients and specialists are empowered through the ancillary IVF support services. Of course, if you're an agency, you can decide to do 1, 2, or 3 things. Medbarn offers support services in third-party reproduction, consulting, and counseling as well. Some agencies just offer advocacy. Some agencies just offer empowerment, try to get help for patients that needs it. Some even offer therapy, like detoxification or acupuncture, any kind of support that you can give to this patient, and most importantly to the fertility professionals and clinics that needs these services for their patients. What are the roles of fertility agencies? To help increase access to fertility care, create awareness, assist patients to identify professionals. So if I have someone, for instance, that have fibroids and has phobia for the knife, the best thing is to refer them to Nordica because they do the HIFU procedure. You have to identify the need and the process the patient is going through to be able to help them appropriately without prejudice, and encourage culture of transparency in ART, to promote public education and awareness, and to ensure effective delivery of good care in ART. Who needs the services? There's so many people in the ecosystem of needing fertility agencies, and those are the patients, the clinics, professionals, not only in the area of fertility, but maybe legal as well, because we do work with legal practitioners to be able to help our patients in the area of surrogacy, most especially. The donors, third-party reproduction area, the donors and the surrogate also needs our help. They need our empathy, they need our services, they need to feel like they're doing this, they need to feel like they're human beings, that they are. Government agencies, I highlighted this point because there was an instance where one of our member agents had to be invited by NAPTIP. That's the National Agency for Trafficking Prohibition, or it was interesting because the patient wanted to travel abroad with the baby, and she was stopped at the airport. So when she was stopped at the airport, she told them that she actually had a procedure done. And they said, well, sorry, you can't go unless you show us proof that you had procedures done. So she had to go back home, truncated her trip, and the agency was invited by NAPTIP to come and give account of the process. So I think it's very important that government agencies realize that, there are people or group of agencies that actually can work with them to prevent baby-making factories. Of course, we know is very lucrative now, and people are going there to get their babies and claim that they've used surrogates. How can agencies help? Of course, we can help by providing efficient services to patients through the clinic, because ultimately the clinics are going to be the one to give the treatment to the patients, but the agencies will be the one to give the support that the patients need to carry on through this process. And of course, I've mentioned this earlier, because we relate with the patient, we understand their needs, and we're able to direct them accordingly, offer emotional support, and also work very closely with the agency. In conclusion, fertility agencies are an integral part of reproductive medicine, and we offer services that can only improve the efficiency of the delivery of a successful outcome in ART. We're taking the hard work off of the clinics to do what they're not able to do. Not that they cannot do it, but they're not physically able to do it. And we will offer those services and help the process along. And last but not the least, it's very important for us to know that this process is highly emotional. We would offer the emotional support, the psychological support throughout the journey, before treatment, during treatment, and after treatment. Thank you very much for having me.